So I came from the NIH Nanomedicine Center for Nuclear Machine. Actually, we have two people coming. Dr. Danan is also here. He will present his something tomorrow. Next, please. Next. Oh, I can do that. So first, I would like to give some background information. So in 1960s, Dr. Larry Hinch from the University of Florida first developed bioactive glass. The key characteristic of this material is biocompatibility. That means the glass material can be used safely in application requiring the permanent implementation. In the past, more than So in the past, more than 20 years, so this material has been used for more than 1 million people, and they are mainly have been used in the field of the dental, orthopedic, and tissue engineering. Bioactive glass material or composition of bioactive glass and polymers has been tested as a delivery system, for example, for the antibiotics, some growth factors. Recently, the people are trying to develop third generation of their material. That is, by definition, it can elicit the cell response at molecular level. In this field, one of the very successful example is that the radioactive solid glass microsphere to treat liver cancer. This method has been approved by FDA in year 2000. Now this method has been used in the US in many medical centers. So currently, the use strategy for using the glass mesosphere is mainly they are using the either bonding to the organic polymers or deposition of the chemical substance directly into glass material. So we are trying to develop a general approach for deliver the biochemical therapeutics. I would like to just give some brief explanation for the solid microsphere. So in this procedure, doctor put the tube from the femoral artery, and then guided by the X-ray, they move the tube up until the light is not point is not working. They can move the tube to the liver, the hepatic liver, which is one of the two blood that supply the liver supply. They can even move their tube further to the right or the left. Can I have their pointer? They can even move the tube further to the right or left, the hepatic artery. There, they can infuse the radioactive glass microsphere. The glass microsphere will block the supply of the blood vessels supply to tumor. And also there, they can emit the radiation because they can emit this beta emission. It is estimated that it can supply more than 10 or 100-fold radiation than the traditional conventional method. So this method is clinically proved to be very useful. I just saw one of the results that one medical center generated. You have a liver cancer here, and before treatment it's very big, and after treatment, basically the cancer is shrink. So in definition, the microsphere should be between the 500 nanometer to 100 microns. In theory, the carrier in this size should be able to deliver proteins or some more chemical compounds. So the ideal or drug carrier should consist of several criteria or functions. They should have a high dose delivery capacity. They should have a conserved release. They should have a versatile drug delivery capability. That means you can not only deliver the chemical drugs, antibodies or siRNAs, or even some radioisotopes. So our strategy, we are using the glass microsphere. I should mention that the glass microsphere, the basic components is a calcium and a sodium, which is a part of our human body's composition. It's not regular glass that we shove. And so it's very comfortable. So let me give you a brief introduction for the porous wall hollow glass microsphere. So this material is originally generated from the U.S. Department of Energy for the purpose of gas storage. But they have never tested the potential application in the medical field. Basically, the structure is a bioglass, so therefore the safety is not an issue. These PWFGMs has big interior cavity, which give this glass piece have capacity to deliver biological therapeutics. One of the very important characteristics of this carrier is that it has a cell. That cell consists of nanoscale size interacted worm-like channels, which allow biotherapeutics internalize. So this is what it looks like in the scanning electron monograph. Generally speaking, the bit size is between 10 to 100 microns, with average size about 50 microns. This is in the same order as a solid microsphere for the purpose of the radio immobilization. So if you increase the magnification, you can see on the cell surface there are interactive worm-like channels. So we have tested different. We have tested using different biological reagents. We have tested dextrin, nucleic acid. We have tested different sizes of proteins. Interestingly, for all proteins that we tested different size, they can internalize, same as a nucleic acid. For the dextrins, if their size is too big, they cannot internalize. And some of this biological region, they show specific binding to the wall. So I would like to go over the data one by one. The first question we ask is, what is the size exclusive limit for the PWFGMs? So we have incubated the beads with different sizes of the dextrins. We found that the 10 kDa until to the 100, they can freely internalize. But if the size is bigger, like 500, it's partially internalized. If even bigger, that is cannot internalize. That's excluded. That means the size exclusive limit is about 8.5 to 14.4 nanometer. So we also tested whether this one can be used for the nucleic acid.